future dentist. Welcome to the new session of General Medicine. Today we'll see about the disorders of renal system. First, we'll begin with the introduction. Renal system comprises of a pair of kidney which is connected to the urinary bladder. Kidney is having an important role in the normal functioning of our body. It is important in the normal hemostasis and composition of the blood. Kidneys are supplied by blood by the renal arteries which are directly linked to the aorta. About 25% of the cardiac output goes through kidney. First, we'll begin with the first disorder, that is acute renal failure. So, acute renal failure means it is a sudden stop or reduction in the normal kidney functioning. Okay, as a result, there is an increased nitrogenous waste deposition in the blood. So, nitrogenous waste deposition means there will be ammonia, urea, uric acid, these all will be getting deposited in your blood. The etiology: dehydration, blood loss, disruption of blood flow to the kidney, blood pressure, burns when a patient is having some burn attack, infection, and allergic reactions like anaphylaxis. So after having these causes, we are going to have acute renal failure. Symptoms: vomiting, diarrhea when the patient is having dehydration, nausea, weight loss, hematuria, itching, and muscle cramps. Coming to the management, fluid management is important if the patient is dehydrated. Coming to the next one, diuretics. Diuretics are administered when there is an increased fluid deposition in the body. Diet management, again salt restricted food has to be done and calorie intake has to be properly managed. If any dosage of drugs are given, it has to be recommended that nephrotoxic drugs has to be completely excluded from the list. Management of anemia has to be given, that is normal blood transfusion has to be done. Control of infections, if the patient is having any sort of infection or there are chances of having infections too. So aseptic conditions has to be strictly followed. Dialysis can be advised if the patient is not improving over the conservative management. Next, we'll see about chronic renal failure. First, we have seen about the acute renal failure. So, chronic renal failure means it is a next stage or the end stage of the renal failure system. So, chronic renal failure is defined as an irreversible loss of the renal function. So, it is not going to be reversed or into a back condition. Next, we'll see about chronic renal failure. So, it is an irreversible stage of renal function. So, we cannot reverse the condition after having into chronic stage. So, usually the chronic renal failure affects over months or years. And apart from this, the last stage or the end stage of the renal failure is known as the end stage renal disease, that is also known as ESRD. This is the severe stage of the renal failure, that is the glomerular filtration rate becomes around 10 to 15 ml per minute. So in this condition, the patient is permanently dependent on renal replacement. That is the only treatment because the other conservative treatments are not going to work out anymore. The main thing we are recommending renal replacement is that in order to prevent the life-threatening condition of uremia. The causes of CRF: diabetes mellitus, hypertension, polycystic renal disease, glomerular nephritis, obstructive neuropathies. Coming to the management, fluid management has to be done first. Then comes diuretics and it is prescribed when there is a volume overload cases. Then the diet management, the patient has to be strictly following a high calorie intake in order to prevent excessive catabolism. Then adjustment of drug dosage, that is if at all the patient is having any sort of drugs administration, nephrotoxic drugs has to be completely avoided. The patient is having anemia, that has to be properly managed like transfusion. Infection and control of aseptic conditions are very important. Dialysis and renal replacement is the final treatment. Then comes the nephrotic disorder or syndrome. So nephrotic syndrome means it is a clinical complex condition. Apart from having renal, there are also extra renal features too. That is proteinuria, Proteinuria means there is discharge of protein along your urine. Then comes hypoalbuminemia, edema, hypertension, hyperlipidemia, lipiduria, and hypercoagulability. These are the other features that can be seen associated with nephrotic syndrome. It is usually seen or reported in children than in adults. And in this condition, the patient will be also having an associated with nephropathies. That is, if a patient is having diabetes and it is a severe stage, this can be the last stage. That is, nephropathy associated with diabetes can be the end result. The signs and symptoms: anorexia, malaise, puffy eyes, abdominal pain, wasting of muscles, edema, pruritus, swollen knees, swollen abdomen. That is, swollen abdomen is also known as ascites. These can be the signs and symptoms. The management includes diet activity, that is, the patient should be on adequate calorie intake and with proper proteins too. Salt restriction is very important in the diet. Diuretics like furosemide or spironolactone can be also given. Hypolipidemic drugs. The main reason is that even though the patient is on a calorie as well as diet restriction, there is increased chances of having hypercoagulability, hyperlipidemia. So in such condition, in order to prevent atherosclerosis, anti-hyperlipidemic drugs are injected or prescribed. ACE inhibitors to control the cases of hypertension. Next, we'll see about the kidney function test. So basically, kidney function tests are done to assess the condition or the severity, the state of any disorders of kidney. So mainly we have got 4 analysis in kidney function test, that is urine, blood, glomerular filtration rate or tubular function rate. Next, we'll see about the urine analysis. So urine analysis is the safest and the fastest way to find out any problems associated with renal system. So here we can have the microscopic as well as a macroscopic examination. Usually in the kidney function test, we are going to see the color, specific gravity, pH and the microscopic appearances in the urine. Coming to the next one, that is a blood examination. Blood examination, usually what we do is the substances that is passed on through the kidney, that is getting deposited in the blood, is being examined here. That is usually the rate of urea, ammonia, uric acid. These all are examined in blood examination. Then comes the glomerular function test. So the normal range of GFR is 120 ml per minute. So when we test GFR, the patient has to be having a normal range of GFR. So when it goes below 30%, there is a moderate renal insufficiency. Next, we'll see about the glomerular function test. So the normal range of GFR is 125 ml per minute. So the main use of doing this test is to find out any problems or disorders associated with the glomerular apparatus. Usually when the GFR rate decreases to 30%, it is said to be having a moderate renal insufficiency. In this GFR test, we are also examining insulin clearance and creatinine clearance too. Coming to the next topic, that is the tubular function test. In tubular function test, what we mainly do is that urine concentration is done here. That is, the normal ability of the patient to concentrate an amount of urine is usually tested here. This test requires a water deprivation for 14 hours in a healthy individual. Usually this test is not recommended on dehydrated patients. And with this, we conclude our renal system disorder. Thank you.